Hi, I'm Briona Jackson.
And hi, I'm Claire Holt, and we're here for UNC Health News Channel 65.
Today we are interviewing Dr. William Rutala about his knowledge on Creutzfeldt-Jakob disease, commonly abbreviated as CJD.
How are you today, Dr. Rutala?
Doing very well, thanks. How are you?
Great.
Great. Well, please tell us a little bit about yourself, specifically what intrigues you about the medical field.
What intrigued me about the medical field is essentially the opportunity to reduce risk to infection and, of course, death.
Great. So can you tell me a little bit about your educational background?
I received a Bachelor of Science degree from Rutgers in New Jersey, a Master's of Science in Microbiology from the University of Tennessee, a PhD in Microbiology from the University of North Carolina School of Public Health, and a Master's of Public Health, also from UNC School of Public Health.
So very qualified.
Very. So what do you do here at UNC?
My responsibility is to prevent healthcare-associated infections. These are the infections that people acquire because they come into a healthcare setting. This healthcare setting, of course, is UNC hospitals, but we try to prevent persons coming to receive healthcare from acquiring infections while they're here.
Great. Thank you.
So what can you tell us about CJD?
CJD is a very unusual agent from the standpoint that it is a prion. A prion is a proteinaceous infectious agent. What's unique about that, of course, is that it has no nucleic acid, it has no DNA and RNA. All microorganisms have either DNA or RNA or both. This particular agent has no nucleic acid, which makes it very unique, and that's why it's called a prion, proteinaceous infectious agent. Of course, prion is just a abbreviation of proteinaceous infectious agent.
Okay, great.
Thank you. Could you please briefly touch on the different types of CJD?
Yeah, there's actually several types of CJD, or I should say several types of transmissible spongiform encephalopathies, or several types of prions. CJD is the most common of the various types of TSEs or prions. CJD, of course, being the most common, is not common at all. It has a incidence of 1 per million population. So in the United States we have roughly 300 million people, and therefore we have about 300 cases in the United States per year. There's a couple other types of prions that are actually even less common. There's one referred, and these are actually familial, not sporadic cases of CJD. Familial meaning that they're transmitted via heredity or genetically. Other two, now their incidence is approximately 1 per 40 million population.
Oh.
Now there's another type of prion that you're probably very familiar with. Of course, that is the variant CJD. Of course, the variant CJD is primarily in European countries, primarily in the United Kingdom. That was associated with persons ingesting various food products, beef that was contaminated with mad cow's disease, bovine spongiform encephalopathy. We do not have the variant CJD in the United States. The only 1 or 2 cases we've had is because people ate the infected beef when they were in the UK or they lived in the UK during the epidemic period.
Okay, great.
So what you're saying is that VCJD or variant CJD is not airborne at all?
No,
Okay.
it is not. It's not transmitted by person to person. It's not transmitted by contaminated surfaces. It's not transmitted by the air.
Okay, great. Thank you. Also, well, you were talking about a prion earlier, and it is a protein that causes other proteins is it the frontal cortex to fold abnormally?
That's correct.
Okay, just making sure that is what your definition of that is.
Okay. So you wrote a paper called Guidelines for Disinfection and Sterilization of Prion-Contaminated Medical Instruments. Can you give us a brief summary of what you wrote about?
Yeah, this is a paper because obviously there are instruments used in surgery. The reason that it's necessary to have a guideline associated with prions is prions are very unique from the standpoint that they are not inactivated by the normal disinfectants and sterilization processes that we use to, of course, treat reusable surgical and medical instruments to prevent transmission of pathogens from patient to patient. So if, for example, if I had a surgical procedure today and my body was infected with an infectious agent, before those surgical instruments are used on another patient, those surgical instruments are cleaned and sterilized so that they won't cause harm to the next patient that use those same surgical instruments. This particular paper looks at this unique agent that is not inactivated by the normal disinfection and sterilization processes and tries to identify how we prevent transmission of this agent from one patient to another. Now, what is unique about prion diseases, of course, there's only certain tissues in the body where the prions are going to be located. And of course, one of the primary tissues is the brain. And of course, if there's any type of neurosurgical procedure where the instruments are going to have contact with the brain, that instrument could become contaminated. And what this paper does is tells you how to treat that instrument so that the next time you use that instrument on someone else's brain, there's not transmission to that other person.
Okay.
Great.
Great.
Okay, so how do you know when a surgical instrument is properly sanitized?
Well, you do test. Normally, the way we know is we have various physical, chemical, and what we call biological markers. Physical markers, for example, is the temperature on our sterilizer. So we know, we get a printout that tells us how hot the sterilizer is, and it tells us how long that sterilizer is operating. So normally, we would say if that sterilizer is working at 134 degrees or 132 degrees centigrade, which is 270 degrees Fahrenheit, for 4 minutes, that will kill all microorganisms with the exception of these prions. So we got that physical indicator. We also have chemical indicators and biological indicators. Now, a biological indicator is essentially a spore that you place into the sterilizer. It's placed in very high numbers, and this spore is much harder to kill than all the other vegetative bacteria, like, let's say, staph or strep or enterococcus that's going to be on an instrument. So if you kill this spore, you're going to kill everything else. So we use these chemical, physical, biological indicators to demonstrate that the sterilizer is capable of inactivating all of the microbes in that sterilization load. Now, a sterilizer is like a chamber that you can think of, like an oven, that you would place instruments into, but of course it's much hotter than an oven.
Okay.
Okay, thank
Great.
you.
So have there been any cases of variant CJD in the hospital you work in?
There have been cases, that is, patients that have come to UNC for health care that have been diagnosed with CJD. Of course, since it's rare, there have not been a large number. That number is less than 10 in the 30 years that I've been here. There have been no cases where UNC or another hospital in the United States has transmitted the disease from a surgical instrument. But there have been cases where the disease has been transmitted by surgical instruments in some other countries, but not in the United States.
Okay, great.
Okay, so since this disease isn't being transmitted in the United States, what safety precautions do you or do the UNC hospital take to make sure this disease does not outbreak here?
Essentially what we do is we work very closely with neurosurgeons, the people that of course are going to be using these surgical instruments, and the site is going to be contaminated if the person has a prion disease. Of course, again, the prions are present primarily in the brain. So we work with them and we essentially discuss with them if they have a patient that they believe have symptoms consistent with CJD, that they take these very special precautions that they're very familiar with on the management of these instruments. So that's how we do it. Essentially, you have to work with them closely to ensure that there's a high index of suspicion. When there's that index of suspicion for this disease, but which of course has neurological symptoms, a pre-senile dementia, they of course tell us, and the instruments are processed in a very special way.
Okay.
Great.
I have one last question for you. We talked a little bit earlier about the different types of CJD, and you went briefly into familial, which is by a person inheriting a gene that this prion is with, right? And
Correct.
there's sporadic, which is from our research, we saw that it really has no cause that doctors know about. Can you agree with this?
Yes. As you mentioned, about 85% of the cases are sporadic. About 15% of the cases are familial. Sporadic, of course, they happen without anyone knowing precisely what causes that sporadic case. We don't know yet why this prion protein in the brain starts misfolding its proteins in a way that causes this disease process. So everybody has a prion protein, but everybody has the normal prion protein. When it starts misfolding and acting, the tertiary structure of the molecule is different, that's what causes this dementia. Nobody knows what triggers this event from a normal prion protein to an abnormal prion protein that causes disease. When we become older, this disease primarily affects persons greater than 65 years old. The vast majority of the cases are after 65. What happens at that point? It may be something like Alzheimer's, which of course is another neurological disease, and some people believe that there might be similarities. But no one really knows essentially what that etiology, what that pathophysiology, what's happened in a molecular way that causes this to happen.
Okay, thank you so much.
Thank you.
Great. Well, thank you so much for your time, Dr. Rutala. We really appreciate it.
Later on in the segment on CJD, we will go more in depth on the medical terminology Dr. Rutala used. Thank you for watching this interview on UNC Health News, Channel 65.